They're written differently. A lot of the words investigators in the scenario. And because clinical skills has been taken away many, many years ago, they have more ethic questions, more bedside manner questions and stuff like that. I would also suggest, because a lot of you are taking the comp exam soon for your school, you should open up your first aid and review normal aging and pregnancy. What happens during pregnancy? Changes in a woman's body during pregnancy, because they love asking questions about normal aging. So you need to know what goes up and what goes down, what increases, what decreases, sleep, heart, kidney, and so on, skin. And then for pregnant women, you need to know how the body changes, what happens with the hormones, the blood, the GFR, and everything else. So you should definitely try to look at those things. They love asking you. One more thing before we begin. If you also have issues with epidemiology and biostatistics, I did post a YouTube video where there are amazing sets of videos on YouTube dealing with biostats and epi. Also, I would suggest do the links that I added or complete the links that I provided via AMBOSS, because I select questions of very, very high yield that you should all know about: sensitivity, specificity, positive predictive value, negative predictive value, accuracy, precision, and the positive negative skews. Equations, don't worry about. Ideally, the first aid has a beautiful pages of equations at the end of the book. Because some people are texting me right now directly, I would suggest if your test is coming up the last 4 days before your exam, you should look at equations, write them out, learn how to use them a little bit so you don't get stuck. But typically when you have questions on the exam, if there are any equation, they have to be simple equations. They can't be too complicated, because remember, you have to answer the test in a matter of seconds, right? You don't have 10 minutes per question. Yeah, cool. Any questions so far? Please listen. I hope you know, here's me. I'm live. I'm in a different background in close to Upper Peninsula. I'm in Wisconsin. So if you have any questions, love to answer them live now if you have, because you have to understand a few things. You can't conquer everything, just letting you know. You can't learn it all. It's not necessary. But a lot of people are making mistakes on little details and stuff that you should know you're making mistakes on, right? So if you see yourself answering questions, you're like, you know what, man, I'm getting 55%, I'm getting 50%. The questions I'm getting wrong, second best answer. That's because you're not reviewing enough. You have to keep reviewing. It sucks. Trust me, I don't like review. When I was in your shoes, I hated reviewing. I convinced myself because I did it once, I know it. But then I realized, why am I getting questions wrong? Because I'm so close. For example, do you know the HIV meds? You could raise your hand, high, low, yes, no, yay, nay. I do. And you say, okay, well, we said as NRTIs, NNRTIs, integrase inhibitors, protease, and also entry inhibitors, right? What are those two entry inhibitors? Remember those two entry inhibitors? There's two words, two names to the entry inhibitors. Do you remember them? You should. You know why? Well, I'll show you. Trust me. The reason why I'll show you is because this happens to a lot of my students. And if it happens to my students, it happens to you because you're my students, right? So I will show you this because many of you are still struggling, which is fine. There is Dr. Mohan goes, Infurvertide. Yeah, 100%, man. You got it. So here's the drugs, right? Boom. You see my screen? Awesome. These are NRTIs. Got it. NNRTIs, beautiful. Integrase inhibitors are nice. You know why? Because the name integrase, tegra, is integra. You can give me 10 different drugs. If they have the word tegra in it, it's integrase inhibitor. This is beautiful. Then there's no exceptions, right? Then you have navirs. If you have a navir at the end of the word, it's always going to be a protease inhibitor, which is also awesome. There's no exception to the rule, okay? So within seconds, you say, well, I'm not exactly comfortable about the other ones, but I know integrase inhibitors, I know protease inhibitors. First step is to be able to indicate and detect out of a list of drugs which ones go where. If you can't tell me which ones are which, forget about the MOA adverse effect. You're going to be in trouble. So first is integrase, easy, boom. Second is protease, even easier, boom. These are even easier. You know why? Because this is what they're going to ask you. Well, let me ask you this. If I asked all of you to just sit a second and say, I want you all to write me a question about these two drugs, what would you do? You're like, well, all right, well, these are the two drugs. This is not a really crazy adverse effect, skin reaction, no big deal. But this is a little interesting, you know. This is for fusion, inhibits fusion, okay? This drug inhibits docking, and they have a little mnemonic here, a little, you know, highlighting to help you remember. That's cool. And then guess what? This is GP41, this is 120. Do you think they'll ask you a question on that? They might. They might ask about fusion versus docking. And if you don't have it settled in your head or set in your mind that 41 is this and 120 is this, what happens is you're so familiar with so much information. You're very familiar with everything. I mean, you remember seeing it somewhere. You just don't remember which one is which. And that is a horrible feeling to have on any exam, especially exam for your future, because you're like, well, I know it, but I forgot which one's which. So what I always do in my videos, and I'm showing you now live, if you haven't seen my QBank videos, which you should be watching, is this: E before M, 41 before 120. Make it simple. All right. So if I ever see fusion, fusion is a 41. And if I ever see anything about docking, docking is a 120. So if you can do that, oh, by the way, check this out, ready? Integrases, yeah, look at this. Integrase only has two listed here, these two names. But if you go further down, there's four. I'm not concerned. Why? Because I see Tegra. I see Tegra. I see Tegra. I see Tegra. This is kind of cool because no matter what I do, if I see a Tegra, it's an integrase. And the Navirs, they're over here. Look how many more they have. Look, the Navirs are only a few up here. Ready? Watch. We only have 1, 2, 3, 4. But here, hold on. We have 1, 2, 3, 4, 5, 6, 7. Quick question for the class here. Indinavir. What is an adverse effect that you must know about Indinavir, which is not in the first aid? Adverse effect. Tell me what you got. Tell me what you know.